Hello everyone. Today we'll discuss about the structure of the inguinal canal. So first we'll discuss about the abdominal. So first we'll discuss about the layer of abdominal wall. So first layer is skin. Second one is superficial fascia. Third one is external oblique muscle. Fourth one is internal oblique muscle. Fifth one transverse abdominal muscle. Sixth one is fascia transversalis and seventh one is peritoneum. Peritoneum is the serous membrane which covers the abdominal organ. So these are the 7 layers of the abdominal wall. So now we will see in the diagram. This is outer layer, that is external oblique muscle. This is internal oblique muscle. This is transverse abdominis muscle, and this is fascia transversalis, and this is peritoneum. So here is one ring. That ring is called as superficial inguinal ring, and here is this facial transversalis also contain one ring. That ring is called as deep inguinal ring. So passage between deep inguinal ring and superficial inguinal ring, that passage is called as inguinal canal. So first definition of inguinal canal: it is the passage between deep inguinal, it is the oblique passage which extend from the deep inguinal ring to the superficial inguinal ring is called as inguinal canal, and it is present in the this muscle. So it is called as intramuscular passage. So now we will see boundaries. There are four boundaries of the inguinal canal. First boundary, that is posterior. Second one is anterior. Third one is roof, and fourth one is floor. Now we will see. This is a brief of the boundary about boundary. Now we will see spermatic cord. Spermatic cord, it is a content of inguinal canal. So which content? 3 covering, that is 3 fascia, 3 covering, 3 artery, 3 veins, 3 nerves, and 3 other structure. So now here we understand definition of inguinal canal, boundaries of inguinal canal, brief introduction of this inguinal canal. Now we will see in the PPT. In this PPT, we go, थोड़ा हम डीप में जाएंगे इसमें. So this is, now we'll see the layer of abdominal wall. Once again we see the layers of the abdominal wall. This is transverse abdominis, this is internal oblique muscle, this is external oblique muscle, and this is aponeurosis of the external oblique muscle. And here is the deep superficial inguinal ring, and superinguinal ring. From the passage penetrate outward. So now this is external oblique muscle, this is internal oblique muscle, this is transverse abdominis muscle, and this is fascia transversalis and peritoneum. This is superficial inguinal ring, and this is passage, and this is fascia transversalis, and this is deep inguinal ring. The canal, the passage between deep inguinal ring and oblique canal, deep oblique canal, which extend from the deep inguinal ring to the superficial inguinal ring, that passage is called as inguinal canal. So now, so this is the inguinal ligament. Above this there is inguinal canal. Now introduction. The inguinal canal is the oblique passage which present lower anterior abdominal wall, which present in the lower anterior abdominal wall. Clinical important in the inguinal hernia. So it is the 4 centimeter long passage situated above the middle half of the inguinal ligament, and it extends from the superficial inguinal ring to the deep inguinal ring to the superficial inguinal ring. Now extent is already seen. Now it is directed downward. Medially and forward. Now we will see boundaries of the inguinal canal. There are 4 boundaries of the inguinal canal. First one is anterior wall, second one is posterior wall, third one is floor, and fourth one is roof. So anterior wall contain external oblique aponeurosis throughout, and second laterally, which contain internal oblique muscle. So these are the associated structure of the anterior wall, not a content. This is the associated structure of the anterior wall of the inguinal canal. Now, so boundaries. Then posterior wall associated with the transversalis fascia throughout, and congenital tendon medial. Congenital tendon means when it is a junction between two muscle tendon, and that muscles are internal oblique muscle and transverse abdominis muscle. Then boundaries may, third one is roof, arcing fiber of internal oblique and transverse abdominis muscle. So associated structure in the roof is the arching fibers of internal oblique muscle and transverse abdominis muscles. Then floor. floor associated with the inguinal ligament and lunar ligament. Hmm. So इन दिस हम क्या करेंगे, इसमें कहाँ एंटीरियर, वेयर इज द एंटीरियर बॉर्डर, वेयर इज द पोस्टीरियर बॉर्डर, वेयर इज द फ्लोर एंड वेयर इज द rope. So this is anterior, so this is anterior, this is posterior, this is floor and this is rope. Understand? Then now we will see boundaries completed, opening also completed. Now spermatic cord. Spermatic cord, it is situated in the inguinal canal. It is only for male sex. So layers of the coverings of the abdominal spermatic cord. So this is the testis, this is internal spermatic fascia which developed from transfer fascia, then crematous fascia which develops from the internal oblique muscle, then external spermatic fascia which developed from the external oblique muscle. So कवरिंग थ्री मसल से डेवलप होती है. सो यहाँ से क्या होता है, हमारा स्पर्मेटिक कॉर्ड ऐसे डेवलप होने शुरू हो जाता है. अंडरस्टैंड? सो नाउ कंटेंट ऑलरेडी सीन, देन ये डेफिनेशन भी देख लिया था हमने. देन हाँ, थ्री फेशियल कवरिंग, then three arteries, three nerves, three other structure present in the spermatic cord. So facial covering are internal spermatic fascia, cremasteric fascia, external spermatic fascia. Then testes, arteries, testicular artery, cremasteric artery and the artery of the vasa deferens. Then genitofemoral nerve, sympathetic nerve, visceral afferent fiber. Then other structure vasa deferens, pimpiform plexus of vein and testicular lymphatics. Now in female, this inguinal canal contains round ligament which travels from the uterine horn to the anchor of the labia major. So clinical importance, it is important for the indirect and direct inguinal hernia, and it is important for the surgical anatomy and shalya tantra. So Ayurvedic correlation, it is correlated with the Vansh Pradesha and useful in understanding the hernia, that is Antarvriddhi. Now conclusion, knowledge of inguinal canal anatomy is essential for the diagnosis and surgical treatment of the inguinal pathogenesis. So knowledge of this inguinal canal is essential for the diagnosis of the pathogenesis of inguinal canal, diagnosis and surgical treatment. So here is the quote, one quote: knowledge is powerful tool, but when it becomes an identity, it can create inner conflict. When sometimes knowledge you wisdom, but sometimes also you conflict. So thank you. Here is we completed inguinal canal anatomy. Thank you.